helping me so much and the people that I'm reaching. When you look at the community people that we go to, I've not given an experience where I went to Arua, and this is my community, and I was talking to them about very many things, and people were like, you people in Kampala, you are now selfish with your things. You're now bringing us the last information when people already did. And mind you that these people don't even have such services. People actually, family planning services are for sale. If you don't have 80, 50, you cannot get. And these are poor people. We actually went to the grassroots in different sub-counties. And the regional hospital, we reached there, there were no condoms. There were female condoms and people are not told how to use them. Then you ask us, actually, I was so touched when I talked to the medical superintendent of Arua Regional Hospital, and I was like, doctor, what is being done? In fact, I was so touched, I had to go to the coordinator, condom coordinator, the Ministry of Health. She told me, you see, we're having a problem, this and that, but just because of the partnership that we've had, we are integrating our work.
Integrating health literacy?
Yeah, integrating health literacy with our work, which we are doing. So, that is something that I can say that has helped. Maybe someone can add.
I think I was, in the morning I was sharing.
So, Jack, you write that down for us as well.
I was sharing with Iris.
Yeah.
I have a stubborn patient in Luwero who stays from, she's born in Luwero but she stays in Kampala. So after the other Gayaza event, there have been these adverts in the paper that whenever you go to a clinic to buy medication, you can get is it the name of the clinic or pharmacy, you start putting the phone and send something. So he was just sharing with me that I think really sharing and getting information is very key. And it has really made me to make informed decisions. Because there is a time he was in Rwanda and he went to a pharmacy, a clinic, then he was like, then the owner would ask, what are you trying to do? I'm trying to find out whether you are registered with So it was so funny. It was so funny, but me knowing his character, he must have done exactly that. Because he really wanted to get the information that, if you are not registered, are you giving us the medicine? So it really came back to really people getting information and making it.
So that was the result of the the health literacy public dialogue.
If I had not gone that side, I would, because he gets papers, he told me, he reads the first page, politics, opens the New Vision and reads the other article of the Kingo, opens the back page and reads sports, and that's the end. But this time he goes in. Yes, so it really.
Wow, that's a good one. Ben, how has this campaign enhanced your capacity, your work, and as a patient leader?
Yeah, I think as someone who works on programs, I realized that some of the programs we are doing them not knowing how best to deliver to the community in terms of health literacy. They are like, health literacy was hidden, you know? It will come out just as a snapshot and disappears. Snapshot and disappears. But with this partnership, we are now able to actually segment it and make it a kind of streamlined program, which is now linking to other activities. So whenever we do a program, we also create awareness and also bring health literacy. In the past, we were like, awareness about this and all that. But then the element of empowering people to make their own decisions, to look at the critical stages of patient navigation and all that, the patient rights, and also the management of diseases. We are now actually clearly brought up in these discussions and partnerships. Of course, it's really all the credit for the beginning, at least, like I've always said, goes to change, because you really try to make it a point that it is streamlined to that point. And health issues are very broad. If you can at least focus on health literacy, and then people will use them in different ways, I think that's really made a lot of sense from all of us.
Joseph?
Yes, me as a health professional.
And you need recommendations as well.
For the last years I've practiced, I've known that medics are actually the ones who hold this information, the custodians of this information.
You thought?
That's what I thought, and actually that's what has been in practice. whereby a patient goes to the doctor and they tell, go take this as I'm saying. But now the health literacy program has actually brought it in such a way that even patients now are able, they're actually informed of what they should do and how they should be treated. That's the first thing. How the patient should be treated, what drugs, everything. So I think this has been a very, very good program, and to me I would say it should continue, because as far as I've seen, how it has been done is still within the center. But Uganda is still big. It's so big, so we really need to expand it to the western, the eastern, the northern. Basically, that's what I can say.
Okay, thank you.